This video is an ethical and legal request for your informed consent to undergo sigmoidoscopy, sometimes called proctoscopy. Your doctor at GI Associates wants you to understand why the procedure is needed, how it's performed, and will also explain the potential risks, complications, and benefits associated with the procedure, as well as its reasonable alternatives. To help you better understand sigmoidoscopy, let's first look at how the body's digestive system works. The digestive system is also known as the gastrointestinal tract, the GI tract for short. The GI tract includes the mouth, throat, esophagus, stomach, small bowel, and large bowel. The lower part of the colon is called the sigmoid and ends in the rectum. Your lower GI tract can be examined with the use of a sigmoidoscope. With precise movements, your doctor will guide the scope into your rectum, around the curves of your bowel to the lower left end of the colon, examining the lower GI tract's lining. The procedure may cause some discomfort. Although the sigmoidoscope is well lubricated, some discomfort may be experienced when it's inserted and navigated through your intestine's curves. You may experience gas or cramping as air is used to inflate certain areas for a better view. Sigmoidoscopy is a short procedure, and sedation or medications are normally unnecessary. Your doctor will further discuss with you if he believes medication is needed. The most common reasons for sigmoidoscopy include, but are not limited to, rectal bleeding, hidden blood in your stool, bowel habit change, abnormalities indicated from other GI tests, lower abdominal pain, checkup for previously diagnosed conditions, screening for rectal and colon cancer if you're over 40 or if there's a family history of polyps or cancer. The sources of these symptoms may include polyps, usually harmless tissue growths, but can sometimes be precancerous, colitis, tumors, diverticulosis, vascular malformation, ulcers, hemorrhoids, or swollen rectal veins. If you've given prior consent, your doctor may treat any abnormality seen during the exam. If found, polyps may be removed or a biopsy may be taken. There is no feeling inside the colon, so you won't realize this procedure is being done. Because the site can be seen so clearly, your doctor can determine if more tests are needed and develop a treatment plan for the diagnosis. Sigmoidoscopy is usually safe and with very low risk. However, you should be aware of all possibilities. Other than the pain and discomfort, risks include a tear of the colon or rectal wall, bleeding, cardiac or respiratory complication, reaction to medications, infection, the possibility of missing a lesion or cancer, and other risks specific to your condition as your doctor will have discussed with you. Risks that are extremely rare but remain a possibility include death, brain damage, disfiguring scars, paralysis, loss of function of an organ or limb. Sigmoidoscopy is a very accurate diagnostic test. Many doctors consider the results cost-effective, sensitive, and low risk. There are alternatives to sigmoidoscopy, however, they are considered to be more invasive. Alternative procedures include colonoscopy, surgery, barium X-ray series, or barium enema, blood vessel X-rays, nuclear scans, and open abdominal surgery. The decision to have sigmoidoscopy is yours and should be based on your doctor's evaluation of your particular problem. If you decide not to have the procedure, be aware that your doctor may not be able to properly diagnose or treat your condition, which could worsen or possibly spread. This video can be helpful in your right to informed consent for sigmoidoscopy, but should not be considered a substitute for discussion with your doctor.